My name is Cindy, and I'm a mental health counselor with Clarity Singapore for about 5 years. At Clarity Singapore, we actually provide individual psychotherapy to adults, mothers, as well as youths aged 16 to 65 years. So for perinatal depression, actually, there's no one single cause. It's usually caused by a combination of factors. So, for example, biological factors, whereby if a mother is more prone and more sensitive towards hormonal changes, there's also this genetic predispositions towards, let's say, mental illness. So, for example, if the mom has family history of mental disorder, then there is likely that be a risk of her getting perinatal depression. Other factors as well would be stresses in the environment. For example, because motherhood, there's a lot of transitions, a lot of changes that they need to go through. So if they face issues like relationship issues, relationship problems, financial difficulties, and I think like in the video of the mom that was interviewed, I think there was a lot of stress from the business. I think it was during the SARS period. And I probably think that she was really worried and anxious about the business and not getting enough income. So that could actually have a very significant impact on the mother's well-being. And inevitably, it could lead to perinatal depression. Okay, so the other common perinatal disorder would be anxiety. And usually anxiety disorders would present itself together with the depressive symptoms. So if a mom is experiencing anxiety, they would usually experience a lot of worry and panic, all right? And a lot of negative thoughts towards themselves. But in particular, they are very anxious and concerned and worried about the baby, how they can care for the baby, and they have difficulty relaxing. Sleep is also one of the difficulties that they would also face. Yeah. If anxiety disorders, there's also OCD as well. So if let's say the anxiety disorder escalates towards obsessive compulsive disorder, it would actually result in a lot of persistent, disturbing thoughts and even images of the mother actually harming the child. But it will not happen because the mother is actually very conscious that this is a bad thought, but it gets her very anxious, and she may even engage in behaviors to try to avoid these thoughts, such as compulsive hand washing, or even not even touching the baby in order to like not harm the baby. There's another disorder that is not very common, and this affects only 1 in 1,000 women, which is known as postpartum psychosis. It's very rare, and the symptoms actually include a loss of touch with reality. Okay, so the mother could actually have beliefs that are false, such as someone is out to harm my baby, or she would see things or hear voices that are not actually there. And so this is actually considered very serious. So if mom actually displays such symptoms, right, she has to be hospitalized immediately. Hmm. So first of all, it's very hard to recognize because most mothers would not be aware of these symptoms in the first place. They would not be fully knowledgeable about these symptoms because they are actually not talked about in any case. And why are they not talked about in our societies? Because of certain societal norms or myths that it is actually very embarrassing, or there's a stigma attached to talking about, if I'm feeling lousy and I'm feeling unhappy during pregnancy or even after birth. Because most people would think that, hey, if you have given birth to a child, you should be very happy. You should not be talking about, you're sad or you're anxious or you're worried. You should know how to handle it because you're a mother. So it's because of these accepted social opinions, right, that mothers also find it very difficult, and they would feel embarrassed to admit that they are going through such difficulties and symptoms. Okay, so for baby blues, right, it's actually very common and it's caused by hormonal changes. So it usually happens within the first few days after birth, and it affects about 80% of women. So they would actually have symptoms such as being very teary, they will cry a lot, they would be irritable. There's a lot of mood swings as well. And of course, being anxious and worried lah, about, how do I care for baby? And the thing is, for baby blues, they would just disappear and, not be present after a few days. But for postnatal depression or perinatal depression, it's actually more persistent and they could last 2 weeks or more. So if the symptoms actually are persistent and last for 2 weeks or longer, there's a possibility that it could be depression, postnatal depression. So I think the first thing to take note is these symptoms are actually common and normal. Okay, so all mothers after giving birth or even during pregnancy themselves, they would experience some of these symptoms, in terms of like difficulty sleeping, being tired, having some negative thoughts, being anxious and worried. So in some sense, they are normal. The thing is, it only becomes, you really need to pay attention to these symptoms if, let's say, they affect your daily functioning. So for example, if you're not able to care for baby, you have very severe sleep deprivation, you are unusually anxious about something that normally you're not anxious about. So for example, if a mom is like fixated over her baby's sleeping patterns and she would not sleep for like 24 hours or 22 hours the whole night, then that is something quite strange and unusual that she needs to look into. So we need to look at the persistency. That means how long are these symptoms actually present? If it's longer than 2 weeks, we have to actually pay attention to it. Second thing is, how is it affecting the mother's ability to take care of herself and her baby? How severe is it? And of course, the intensity itself, how serious are the symptoms in terms of affecting her way of, caring for herself and her baby? For myself, I feel that mothers need to be able to have that courage to actively state what they need and how they feel. Okay, before it reaches a level whereby it becomes difficult for them to cope. So this is something that I would really encourage mothers to do. And I know it's difficult because of the societal norms, because of the, I guess, culture that we are in. But nonetheless, I think, mothers really, really need to take that first step to state how they feel and to also express what they need from others. I think that's a very tough thing for mothers to do, to sometimes admit that they need help and to accept help from people because they are so fearful of judgment, right? That's the number one thing that they're so afraid of, that if I ever open my mouth and ask for help, what would this person think of me? Will they judge me? Will they call me, like an incompetent person and all that? So this fear is there. But the thing is, I really, really encourage mothers to do that because it's going to benefit themselves and the baby and definitely the family itself. So the thing is, if talking openly about their feelings, about things that don't go well, things that go well, and not having this belief that they need to be a perfect mother. So that would be something that I would really also encourage mothers to think about. Okay, so the thing is, perinatal depression is an illness. Okay, it is not a mistake or a weakness on the part of moms, and moms are never to blame for this. It's not something that they have caused. And all symptoms are actually treatable. So it just takes, the first step for them is to seek help. And just like what the mother in the video said, that she's also encouraging mothers to step up and seek professional help because that will be a sign of strength and not shame.